Okay, you are now live.
Okay, welcome back to everyone. This session, we're launching the Social Variance Network for the COVID-19 project. And I'd just like to remind you that there is a translation function. So in English, French, and Spanish, we'll be conducting this mostly in English, but we can take questions in English or French. So it's my pleasure to introduce to you my two colleagues. Dr. Jasmine Thomas is the postdoctoral fellow on the COVID-19 Network and Social Variance Project, as well as the larger social impacts of COVID-19 project for Canada, the US, and Mexico. She joins us from Winnipeg. And Dr. Jack Jedwab is the president and CEO of the Association of Canadian Studies and Metropolis Canada and Metropolis North America. He's situated in Montreal, and I'm betting that almost everybody on this call knows him. So if you don't already know him, you'll get to know him and understand that he's a mover and a shaker. So I am going to start this half an hour session with a brief description of the COVID-19 network on the social impact of variants. The idea is that to better coordinate and consolidate research and public knowledge around the social policy impacts of SARS-CoV-2 variants, our research team will convene an international network of academic, community, Indigenous peoples, governance, ethnocultural associations, and government partners, tentatively called the Network to Inform Social Policy on COVID Variants. They have a little acronym that's a bit clumsy, but the network is comprised of a multidisciplinary group of policy and public experts from Canada, the United States, and Mexico, with a particular focus on the concerns of Indigenous peoples, racialized persons, immigrants, and refugees, groups that have been disproportionately affected by COVID-19. They're more likely to catch it, be hospitalized for it, and sadly pass away from it. But it is these groups of people that have been largely ignored in many public health campaigns. So without further ado, I will pass the floor on to Jack, and he will walk you through the impact network. Thank you, Jack.
Thanks very much, Lori, and thank you, Jasmine, for all the hard work that you've put into this project so far. And the project actually is a bit of an extension of our CIHR initial fund, which was and is doing research in multiple waves of survey work with substantial oversamples for Indigenous persons, newcomers, and racialized groups. So we've now done two waves of that of those surveys, and we're going to shortly commence our third wave and be going to the field with that. And that research will help us inform some of the discussions and conversations that we'll have via this network, which in effect will replace the previous network that we have, which is the Social Impacts Network on COVID-19, that some of you probably in this Zoom video conference have participated in, not all of you, and that's been convening sort of every week initially, and now every 2 weeks. So now we'll be sort of branching out to include our colleagues from the United States and Mexico, and those who are currently participating in our Social Impacts Network in Canada, and add to that those who are interested in the issue of variants, which is, as we know, given the evolution of the contagion, and those of you who heard Julian Areno got the sort of lesson in terms of the historic background of contagions, which, as he said, no borders. But we can see that there'll be increasing attention directed on the variants, and as the contagion evolves, it will be an increasing focus in terms of policy, I think, conversations, recommendations. So with that said, I'm going to share with you the results of a survey that was done last week that you'll be probably the third plus the third, fourth, that's Lori and Jasmine, plus all of you participating persons to look at this, because I showed it to my son over the weekend. But otherwise, no one else has seen this. So briefly, just to Again, the little more of an introduction, as Laurie read you a paragraph about our network, which Laurie, as you were speaking, I was actually thinking of a potential new acronym, which I'm still sort of in the process of considering. It's so that we've got that clumsy acronym, so we got to get something a little more catchy. So, I'll be working on that for the rest of the week, and get back to you with a report next Monday. But by and large, we're going to be convening in a network, reviewing some of the research and findings arising from what CIHR reports to us, particularly with that focus on variants. But we'll also be looking at some of the issues around migration, some of the things that Julian alluded to, and that relationship, as you can see in the second paragraph, between the global reach of vaccines, for example, in dealing with the contagion and in fending off the impact of variants. And what this means for migration, given the unevenness globally of vaccination rates. Canada, I think I can say, is doing reasonably well at this particular time in terms of first doses, and we're making a lot of progress in terms of the second dose. But there are a lot of countries out there where vaccination rates are low. And if we're going to get back to full normal, whatever that may appear to be at some point in the not too distant or more distant future, hopefully not too distant future, we'll need to ensure that the vaccination rates are high elsewhere in the world. And hopefully our country will take a big lead in that regard. And that will help us to normalize the migration mobility that we enjoyed before the pandemic. Right. So this is just the methodology for the poll I'm about to present. Basically, it was 1,542 respondents. This poll was done only in Canada. Again, our research going forward as regards the variants via the CIHR will be in Canada, Mexico, and the US. But this is sort of a, if you like, a bit of a test run for some of the things that we may be looking at. And it's actually really aimed at testing knowledge at this point. So that we're looking at 4 issues. One, was the emergence of the variant a surprise? And according to the CDC, the variant did not arrive unexpectedly. Viruses or variants did not arrive unexpectedly. Viruses constantly change through mutation, and new variants of a virus are expected to occur over time, right? As a fact, Julian quite, I think, carefully and thoughtfully demonstrated. But most Canadians believe the following. The COVID variants caught health experts by surprise. Actually, most of us think that they did catch us by surprise, 62%, which is the incorrect answer. 38% think that statement's a false statement. There's a greater inclination for francophones to feel that's a false statement. And there's a lesser inclination on the part of visible minorities as opposed to persons who do not belong to visible minorities to think so. Sorry, I got skipped ahead there. Point number 2. Do we know whether the new variants are more likely to cause severe illness or death? That idea runs counter to the view that variants are more contagious. Some suggest that because they're more contagious, the net outcome is that where a similar number of persons get infected with the original virus versus the variant, a somewhat higher number could die. But that may simply be because more people are getting infected, since the variants are more transmissible, not because the strains themselves are causing more deaths. Still, for their part, 7 in 10 Canadians believe that the COVID variants are more deadly than the original COVID-19, right? So 70% believe that to be true. Francophones seem a lot less likely to believe that's true. I don't know what that's attributable to, but that's what the poll shows at this juncture. Okay, so now we move to the next question. Do vaccines work against the variants? Both the Pfizer, Moderna, and other approved vaccines do appear to protect against the known COVID-19 variants. And while there's some indication of be less effective against the Delta variant, that doesn't imply that they're not effective still. For their part, 3 in 4 Canadians believe that our current vaccines do not work against the COVID-19 variants. Actually, 3 in 4 Canadians believe that's false, which is the correct answer, right? They do work in effect against the COVID-19 variants, and that view is held by 27% of Canadians pretty evenly, right, across the spectrum. So 4, can we prevent the variant? Oops, here we go. Sorry, back we go. The variants are definitely spreading around the world, and certainly that is the case here in Canada. And while that sounds worrisome, the situation can be mitigated with protective strategies that are in place to combat the original strain. Vaccination is the most important means to curtail the spread of the variants. For their part, Canadians are divided as to whether we can prevent these variants or future ones from spreading, right? And again, pretty evenly across the spectrum, whether it's Francophone, Anglophone, other, there's minorities or not. Canadians are split on whether we can prevent these variants or future ones from spreading. So that's, and there's methodology reviewed here for the survey. But that's by and large what I thought we could share by way of sort of beginning a conversation with those who are participating here as regards the knowledge about variants. And, you know, I think it's a beginning point. You know, we're going to be delving into the issue in a lot of ways and seeing how the knowledge about variants and perceptions about variants impacts on various other views and behaviors as regards the contagion. But I thought for this purposes of the discussion at this time, it was a good starting point, because good knowledge will help us if we're going to be empowered to properly address, you know, the issues going forward, you know, at a time where I think it's fair to say we are experiencing evolution in attitudes, most certainly experiencing evolution in people's attitudes and behaviors as case numbers decline. But as, you know, most observers and experts will tell us, there's a need to be vigilant, because, you know, we can't predict with certainty, you know, what the, you know, next few months are going to look like. And the more people I speak to, the more opinions I'm hearing. So, you know, the continued need for measuring out the social and economic impacts of the contagion and of what, you know, the variants may mean. Because actually, if you sort of are monitoring, if we did a discourse study right now, I bet we'd hear a lot more people talking about variants and the Delta variant than we were previously. And so you're seeing the shift in where the COVID-19 being part of our regular conversation, moving to the Delta variant being part of our regular conversation. So a slight paradigm shift there, but it's not one that's by any means benign or insignificant, you know. And so, you know, we're very thankful that CIH are supporting us in terms of our efforts to not only continue the research, but to continue the discussion and conversation and elicit views from some of our experts and you know, be in a position to make recommendations and share our findings publicly, as well as with our expert advisors. So I'll stop there, and it's a little sort of kind of short and sweet, if you'd like, you know, as opposed to the usual presentations. But you know, it's the launch and beginning point. So whatever comments, suggestions, questions, observations, directions anyone wants to point us to, you know, feel free to do that. And Jasmine, if you want to say a word or two, you know, now's the time. It's sort it's whatever, forever hold your peace type of thing. So
sure. Thanks, Jack, for providing that overview. I think there's it's interesting, but also I think there's a lot of public education sort of policy needs that really need to be addressed there. I think, you know, for me, Dr. Areno's presentation was extremely interesting and really informed me how, you know, quarantine may be a more effective policy intervention rather than travel restrictions. So I think some of those points will be really important as we sort of navigate how we get back to some semblance of normalcy. And I think as we do that, I really want to know, of course, what are the ongoing implications of the pandemic on our populations as a whole. But we also know that the vaccination rates are going to be different across various groups, across various countries. And so knowing how that impacts people, I think will be really important going forward. And then I guess, how do we transition to a new normal, and how do we recognize the issues that arise from that? And, you know, what are the longer term impacts on physical health, mental health, but as well education and employment? Because now we've had almost a year and a half where some folks have been, you know, vicariously employed, unemployed, you know, interruptions in education, and that's going to affect different groups differently. But then I think sort of on the flip side, one thing that the pandemic showed us is accessibility. So, there's all of these accommodations that have been possible. So for folks with disabilities, they've had greater access to services and education in ways that weren't necessarily thought to be possible before. So those are some of the thoughts that I have going forward. And of course, we're always looking for feedback from, subject matter experts about where to focus next. Thanks.
Perfect, thanks. So as you were speaking, I just was looking up the answer to one of the questions, which was about sample sizes for Vis minorities, Francophone, Anglophone, and there are other demographics, by the way, that I could have obviously used for purposes of the presentation. There's gender, education, there's employment, regions, age, etc. But there weren't many variations in any of those sociodemographic groupings. So I looked to the ones where there were some variations. And just to answer your question, for Vis minorities, the absolute as opposed to the weighted number was 269. The sample for Francophones, again, the absolute, not the weighted, was 366. That's the unweighted when I say absolute, sorry. 983 for English persons and 192 for persons whose mother tongue is neither English nor French. I'd like to say that those numbers are, so rounded, but they're not. Actually, those are the actual numbers that I'm sharing with you as I sort of see them in the survey. And we could share the data set as well if people would like by posting it on our website. There are, I see another question. Lori, should I just do this? Okay. Are we going to interview people to see where they get their information about COVID from and how they validate the information? I would say the answer to that is yes. Jasmine, that was a very short answer. Hope that's okay.
We'll be speaking about that in regards to Indigenous peoples in the next session. So we've collected data, as Jack knows, on where do you get your information about COVID-19? And so we're looking at this with regards to Indigenous peoples in the very next section. So
yeah, I wouldn't think, and it's not impossible, but that people get information about COVID-19 or variants placed differently or different than they got their information on COVID-19 more generally. The way we're sort of operating right now is, we've got we'll have probably about 6 cycles of our survey. So we're doing a bit of a rotation. So if we ask sort of a block of questions, for example, about discrimination in wave 1, but not in wave 2, but we will be returning to it in wave 3. And we asked about information, I believe, in wave 1, and we're asking about it again in wave 3, right? So we'll be able to do those comparisons across time, but I'd be pretty surprised if people changed substantially the way in which they secure information. But we're monitoring, so we'll be able to make the comparison if needed. Right, Jasmine, any?
I guess the only other thing to add is, in addition to the surveys that we run, the larger CIHR project is a mixed methods project. So we'll also be interviewing people in each of the 3 countries. And so a variety of questions will hopefully be answered that can't necessarily be answered by a larger survey research.
Yeah, I mean, the information issue, a bit of the challenge in the information issue has been that given the interconnection between various media platforms, it becomes sort of more important in terms of collecting this type of information to get more granular about it, which isn't easy, right? So, if you give a list of media types, for example, if you sort of radio, newspaper, television, old sort of mainstream media, right? Without getting into the specifics, all these things are interconnected to other types of media platforms, right? So people get their information from Google, they may be actually getting that information. If they go further, Google may be getting it from some other platform or whatever, Google News may be getting it from other, somewhere else that is connected to a mainstream media, which is connected to a social media platform. So it's good to get more granular. And I think we did try, Jasmine, to ask people in an open open-ended question, or we're about to do that for this wave, to name the specific media. I mean, it would be interesting in the US, for example, if you're saying you're getting your information from, television news media source, I suspect, if you're getting from CNN versus Fox News, then that's going to, have some bearing on what conclusions you draw, with respect to the contagion or the variants, right? You're watching on Fox, you probably think you may think there isn't actually, a contagion happening right now, as opposed to CNN, with all due sort of respect and deference to Fox and anyone who on this call watches that network get their information. Yeah, so I think that's something that has been a bit of a challenge to us in terms of the way in which the questions are put to people. And we have understood from our first wave that we need to get that, more specific detail in terms of where you're getting your information. There's another question, right? So, are you also trying to find out people feel about importation of variants, whether they believe flight bans are necessary to contain the spread of variants? Yeah, I mean, I think we've asked variations of those questions in previous surveys about flight bans and border closings and, and so forth. I don't know that we've put a specific question about flight bans. I think we focused more on border closings. But we can discuss adding some variation of that question in our forthcoming surveys, so, I mean, it's a bit of a proxy for border closings, right? In a way, the flight ban idea. So, but we've tried variations in those questions, including, what about countries where, there are high rates of the contagion and how people feel about people coming from countries with high rates of the contagion. But at the same time, most people are comfortable with, people go through the health and safety protocols and do the quarantining, then there shouldn't be a reason to not permit them to come to Canada if, they've sort of responded, either they're coming in as refugees or responded to either our economic criteria or family unification. I don't know. Laurie, you have any thoughts on that, or Jasmine?
I would think that, this moratorium on people moving can't last much longer given the backlog of people who either need protection or the fact that, we're talking about just in Canada, hundreds of thousands of people coming for economic and family reunification reasons. And then we amplify that by 10 for the United States. And then looking at Mexico, the number of people who are going through Mexico right now, I think regardless of how we resolve this, I don't think because I think what we've done is we've just put off the decision making. And I think, if we don't make a decision fairly soon, it's going to exacerbate the situation. Yeah. I'd also like to point out too, I think two of the important aspects of the variance network that I think really can help the situation in all three countries is the fact that we're able to measure what people think about the variants and how they think the vaccine may or may not work against variants versus what is actually true about the vaccine, about how it may or may not work against variants. And that it points to a very important public policy issue, and that's public awareness and education. This is fast science. And so it's hard work for the people to keep up with the messaging. But I think if you listen to some of the results that we're coming up with now, it really points to the fact that education around the science around vaccines and education around the spread of the variants may help with that 27% that the current vaccines won't work against variants. And I think the other benefit of our network is that we're able to measure our communities, and that's multiplied, right? In Canada, the US, and Mexico, we're able to measure our communities' willingness to abide by various local restrictions and national restrictions. Also vaccine uptake too. And so you take all those three components combined, and it gives us kind of a measure of how much people are willing to contribute or put up with. Because as a sociologist, I'm actually a bit surprised that after 16 months, we haven't seen wider spread rejection of public restrictions. And what's going to happen now that, at least in Canada and the United States, we're loosening restrictions? If we have to go back, if like a new variant comes and we have to lock up, like what are our chances of being amenable to locking up again? So I think those are the two big contributions of our network.
Yeah. Sorry, that whole flight bans thing made me think of the original controversy about Corona beer, right? I'll tell you, because it's the Delta variant. So I was sort of thinking, are we going to sort of have these people who, don't want to drink Corona or fly Delta, because of the. But anyway, forget that. So it's sorry, another question, I gather, right? Let me check. No, I think that's it. No questions. I see there's no questions. Good.
Perhaps, Jack, we can tell people how to get involved with the new network.
Yes. So I think the way to do that, we're about to hire a coordinator. We'll have a coordinator come on board soon. We work with Jasmine on the Variance Network, right? And I suspect in the meantime, they should probably get in touch with Jasmine, right? Jasmine, I hope that's okay, if they're interested in being part of the network, right? So. And I think, Jasmine, you're putting your email address up on the, good. Okay, perfect. So that would be the way to do it. That's it. All right. So unless there's something else, this is amazing. We've actually gotten this done before the end of the 30 minutes that was allocated to us, right? I'm at, 27 minutes. And so that'll give people a little more time before we go on to the next session. I think we resume again at 1 p.m. Is that correct? So, so take this opportunity to encourage everyone to continue to participate with some very interesting workshops this afternoon, beginning at 1
Yes,
p.m.
in one half hour.
Exactly, in 30 minutes. So have a quick lunch or whatever, and or whatever else, and we will see most of you, if not all of you and more, at 1 p.m. Thank you.
Thank you.